I am Dr. Chioma Ukanwa. I work in the Federal Ministry of Health and Social Welfare of the Federal Republic of Nigeria, and I work in the Department of Public Health in the HIV/AIDS, viral hepatitis, and STI control program. And in this program, I head prevention. PAN prevention is quite timely, looking at where we are now in the HIV response, both globally and in Nigeria in particular. So we are pushing towards service integration, and the least we can do is integrate at the level of prevention. Putting everything together, normally in Nigeria, we look at biomedical prevention, look at behavioral and structural. And in PAN prevention, we are forced to look at this holistically and be able to plan and have minimum package of care that should speak to the whole client. Every recipient of care is able to have access to the different packages of care for prevention in one clinical experience, and then be able to get referrals where need be, and a client-focused care that improves patient experience and treatment outcome. Okay, in context in Nigeria, PAN prevention will strengthen our service integration approach. In Nigeria, at a time like this, we are trying to integrate completely at all the levels of care: primary health care, secondary health care, and tertiary. So this is an ongoing intervention now. We've done some policy review to reflect that, and in terms of actual implementation, the PAN prevention approach comes very handy because it answers a lot of questions and helps us not to sweep some components of prevention under the carpet as we are integrating. So if we're not intentional to bring up all the pieces of prevention, some may be lost in the face of service integration. So PAN prevention is timely and very useful to us in Nigeria now. There could be, in trying to do full implementation, definitely there will be some challenges, and part of those we are envisaging a capacity building. Now you want one health service provider to be able to provide a service. So what we are doing, we're looking at reviewing and updating our training curriculums for service providers to expand their capacity, their knowledge, what they can provide, because you have to empower people to provide what you want them to do. Before, the trainings were siloed, but now we are trying to change all that, especially for looking at the curriculum. And even we have our e-learning platforms where we do the high frequency, low dose capacity building. So looking at also riding on those mechanisms to continue to build capacity of the healthcare workers to ensure that they're able to implement PAN prevention as we are rolling out. Like you said, I'm quite new in the seat, and the engagement with SSLN has been very timely for me as well, in the sense that it supports me. Going through the training. Before now, I've had the engagement with some of your staff. We had interviews, discussions, and then the tools that SLLN projects, and then the capacity building, the support. It helps the leadership for prevention. So especially in terms of prioritization of interventions, I was very excited when we were going through the tools. So like now we are preparing to write the GC8 for Global Fund application. So the training, the tools comes handy to support our business case, our investment case development. So that's, I think, is very useful to us. And going forward, is really going to help us to be able to streamline our prevention interventions, and be able to look at the cost-benefit analysis and see how we're able to make the best out of the little resources that we have. All of us know that the resources are winning, so we need to put up our best. And SLN support is very useful.